House calls for the unhoused, stories from street medicine. In this podcast, we share the honest truth of bringing healthcare to our unsheltered neighbors on the streets. We are USC physician assistant students who were the first cohort to complete a street medicine rotation. These experiences changed us forever. Through this podcast, we hope to address your questions and fears to show you the true heart of street medicine.
So I'm going to start by telling you all a story. This summer, I was fortunate enough to do a street medicine rotation. And on my first day, not knowing what to expect, I jumped on board the mobile clinic van with the rest of the street medicine team, which consisted of Dr. Coley King, badass nurse Jackie, and Sweet Nick, a therapist from the People's Concern. And we headed out to see the day's patients. We pulled into a gas station at a busy Santa Monica interstation, and despite what I thought, we weren't getting gas. We were there visiting our first patient, Luis, a 30-something-year-old living outside the gas station who was found by the street medicine team just about a month earlier, swollen from head to toe with severe decompensated heart failure. He was brought to the hospital where he was found to have an ejection fraction in the low 30s. And at one point during his month-long stay, his heart stopped and he was brought back to life. Now, after having been discharged home, which for Luis was the gas station, we were responsible for his medical care. Every week we would visit Luis. He'd be expecting us and would sweep a small area of asphalt and invite us to sit on some overturned buckets he'd set out. He'd graciously host us in his gas station parking lot home, and we would get going with his medical visit, taking his vitals, charting his weekly weights, doing a physical exam, and dispensing and adjusting his medications. With our support and close follow-up, Luis was getting better. Together, we discussed his incredible health progress and how to overcome the challenges of safely storing and appropriately taking the so many medications that he needed to take that were all crucial for his survival. He proudly shared the growing number of days it had been since his last drink, and we'd admire the good-looking squash growing in his garden in a small sunny patch of dirt just next to the gas station parking lot. It was through this experience with Luis that I learned to see homelessness as a health condition in itself that requires special training and attention to be treated effectively. I experienced how being a part of a medical team that exercises humility and compassion and just keeps showing up really can make all the difference for people experiencing homelessness. So the problem that our project and intervention sets out to address is this. With the growing number of homeless individuals in Los Angeles comes an increased need for healthcare providers who are well-versed in the complex needs of those living unsheltered on the street.
The rationale for our project is that being part of the inaugural class to have done street medicine rotations, our group really wanted to seize this moment in time and this unique opportunity and privilege of being able to share the profound experiences we all had on our rotations to get the next generations coming after us excited about starting street medicine. And not only that, we also wanted to address some of the concerns and hesitations that some of them might have that we ourselves also had that might be dissuading them from considering street medicine as something they want to study. So we started a podcast. We gathered interviews and stories from street medicine providers that are pioneering programs right in their own communities. And we chose the podcast format because it's something that's easily accessible and relatively effortless for our audience, something they can listen to on a long commute home, while they're out for a jog, or while doing other things. And we also thought that a podcast has the potential to continue as this living entity that future students can contribute to whether they pick it up and add their own story, another provider story, or a patient story. And in the end, our goal is to spark curiosity, to increase participation in street medicine rotations, and ultimately, we hope we're planting the seeds that will increase the number of future street medicine providers who can meet unsheltered patients where they are, because they have so many needs. Health literacy, cultural humility, communication skills, trauma-informed care, inclusion, and advocacy. These are all things that are at the heart and foundation of street medicine. And we made sure that we incorporated these into the design and the content of the interviews that we featured on our podcast.
Now for some stats and findings. Our group found that according to the US Almanac done in 2020, roughly 66,000 homeless residents reside in LA County alone. Amongst them, 48,000 are unsheltered and around 18,000 are sheltered. Now, keep in mind, these numbers were taken prior to the pandemic. So these numbers for sure have increased since then. We also found that the life expectancy in individuals experiencing unsheltered homelessness can be 30 years shorter than their housed counterparts due to health disparities and lack of regular primary care. And this increase in number of homeless population increases the demand for more street medicine providers. Roughly only about 25 street medicine teams are in operation in the entire state of California today. We also found that street medicine has shown to decrease EMS interactions and ER visits when followed by a street medicine team with a housing first approach, and an increase in access to primary care by over 250%. So next slide. So some articles that we found, the first article was done in 2019 by a group of registered nurses who did a needs assessment, more of it from an international viewpoint. So they did studies across US, in countries in Europe, and as well as Canada. And what they concluded is that the population prioritized necessities such as shelter and food over their own healthcare. Another finding that they found was that the majority have had a negative experience with healthcare providers, whether it be lack of empathy from the provider or a lack of understanding of their situation. They also faced a lot of healthcare prejudice, and ultimately they were given unrealistic treatment plans with their limited resource and access to home and health. So this group concluded that designing and provisioning team-based multi-professional interactions that include social workers, medical doctors, NPs, PAs, dentists, and therapists, along with the collaboration with people living on the streets, will be key to bridging this healthcare gap. Another article was done in Touro University in their PA program. It was a student-led mobile clinic that was designed in July 2014 that involved both students during their clinical rotations as well as students in their didactic year. And what the outcomes were that it's improved the intercommunication skills of the students, as well as the clinical skills such as wound care, INDs, suturing, and their SOAP notes. That demonstrated an increase in number of students wanting to get into primary care and serve the underserved. Students observed themselves a variety of exacerbated common chronic diseases such as CHF, COPD, psychosis, as well as various skin conditions and infections such as cellulitis. Ultimately, this encouraged them to think outside the box about treating patients who are less likely to seek follow-up care or who are just difficult to track. And ultimately, it taught students to treat patients, in a respectful, holistic, with sensitivity to the patient's life experiences. And they took this along with them as they became, certified PAs in their practices. Lastly, an article done by our very own Ms. Feldman and Brian Stevens, students were found to be open to learning about homelessness in a health equity curriculum, but they expressed fear and hesitancy when discussing the street setting. So this demonstrated that there is a clear need for more preparation education before students embark on clinical street rotations. And that's why our podcast is trying to address that need.
So an overview of our project from start to finish, we conducted a needs assessment, we created our podcast, and then we sent out a pre and post questionnaire, and the results of which we'll share with you in a few slides. For the needs assessment, we asked pointed questions at class of 23 and 24, and they told us, here's what they said, that the majority of them had little to moderate or no interaction at all with the unsheltered population. Most of them were either on the fence or maybe not ready at all to start a street medicine. And almost all of the students felt that there was a clear need for additional street medicine training. And they said they wanted to hear from everybody, from providers, from PA students, as well as from individuals experiencing homelessness. And most of them expressed having some kind of physical or emotional safety concern. So we incorporated all of these considerations in the interviews that we conducted for our podcast.
So after we released the podcast of our interviews with all of the street medicine providers, we had the participants do a pre and post survey about their thoughts and feelings regarding street medicine. All of the responses were from people within USC's PA program, and we got some really pretty great results. There was an increase in PA students considering a rotation in street medicine and considering practicing street medicine. There was also an increase in students saying they felt more prepared for street medicine rotation, and a decrease in concern for physical and emotional safety after they listened to the podcast. And we had a jump from 79% of students considering street medicine to be important to 100%, which is awesome.
Okay, so for analysis and discussion, so the results we received in our pre and post survey, we can conclude that our intervention did in fact show an impact in the increase of street medicine interest and awareness. So the goal was to create an intervention that would contribute our fellow students to feeling safe in the street medicine rotation and more inclined to sign up. And through this survey, as Nicole mentioned, there was an overall increase in interest, increase in reassurance about their safety, and overall 100% increase of participants that now see the importance of street medicine. And overall, our street medicine podcast has generated positive feedback, and ultimately we created a lasting intervention that students after us can continue in order to highlight the importance of this rotation. And so now I'm going to go through some obstacles and barriers that we did face. So initially it was difficult to narrow down a specific topic and really find a focus for this project because there's so much that we feel is necessary to cover. But we plan to initially focus more on reality-based medical skills, mental health treatment, and addressing substance abuse. But to condense it down, we surveyed our audience and we decided to put our focus on answering students' questions and address any preconceived fears that they mentioned. Our second barrier, it was an obstacle to get actual patients to be in our podcast. The scheduled times to meet our unhoused patients is never guaranteed due to unpredictability of their location. So this is a proposed solution. We were not able to conduct this due to the timing that we had with this project, but the plan would have been to go out with an actual provider that planned to see a specific patient at their shelter or home. This way we would have a higher percentage of meeting the patient and being able to interview them for the podcast. And then for another challenge, so our goal was to ultimately create an intervention that would reach a larger audience and leave that lasting impact for others to contribute to. So we decided to design this podcast with hope of it lasting into the future where other students can pick it up and make more episodes. And also after this project is due, we hope to share it with a wider audience, perhaps Street Med Institute or wider platforms that can serve to further inspire more students to go into Street Med. And the last barrier is really getting people to listen to the podcast and complete our pre and post survey. And while we were able to get a decent amount of responses, if possible, we would have liked to host a live event where attendees could listen to the podcast together and fill out the survey while at the event. And another solution we came up with was really just spreading the word via social media, and also did some class drop-ins to make announcements and really try to create a captivating pitch to really draw people in to listen to the podcast and participate in our survey.
So why should you care about street medicine in general and about our project? As we've explained, there's a growing number of people experiencing unsheltered homelessness in LA. And with these increased numbers comes more health disparity. And there's a clear, dire need for more healthcare providers who are trained in the complex needs of those living unsheltered on the street. When we think about what connects us all, whether we have a home or are unsheltered, it's the fact that we all call the city of Los Angeles home. Imagine how strong we could be as an entire city if we were all healthier and achieved health equity together. So I'm asking you to consider rising to the challenge of addressing the humanitarian crisis of homelessness in our city. If you're a person that loves thinking outside the box, hates wearing their white coat, and dreams of working outside in the sunlight, you may want to consider street medicine. The skills and lessons you'll learn from the street will stay with you forever. Thanks for listening.